Okay, it's 11:30, so we'll go ahead and start. Thanks everyone for being here. This is the session on the connection between health literacy and patient outcomes, presented by Jessica Daly, who is the head of library outreach and marketing at AdventHealth University.
Hello, everybody. So Allison, can you see my slides?
Yes, looks good.
Okay, perfect. So thank you everyone for being here today. This is definitely, you'll see through the presentation, something that I'm super passionate about. Have worked with health literacy and been on the patient side and the patient family side for many years, working as a medical research librarian for patients and their families, which is very unique. Normally we have medical research librarians for our health professional staff, the clinical side of things, but not often for the patients. So this gave me a lot of insight and experience into the topic that we're going to talk about today, and how health literacy and patient outcomes are truly interconnected in every way. So to tell you a little bit about myself, I'm head of collections and electronic resources, and also head of library outreach and marketing for AdventHealth University. So many of you may have heard of AdventHealth Hospital System. We're nationwide, but we have our headquarters and our beginnings here in the state of Florida. And our headquarters of all of AdventHealth is just about 10 minutes away from where I come to you today in downtown Orlando. So we are so excited to be able to be a part of this summit, and also just tell you a little bit about us. So we are a health sciences university. And as I told in an earlier session, I tell people in a nutshell, we do everything in healthcare except for the medical doctor. And so we have everything from nursing to physician assistants to all types of occupational physical therapies, radiography. So we really do have our hands in all types of healthcare. And so our goal is to make sure our students leave here and become the best healthcare professionals possible. So I get to be a part of that. And so it's very, very special what I get to do. So bringing my academic and my hospital backgrounds all into one. So I'm going to start out with some facts, because as librarians, that's what we do. We find facts. I love when people say, "Oh, Jessica, you know everything." And I say, "No, I know how to find everything." So I don't stop until I find the information that used to, in prior roles, patients and families needed, but now what my students and faculty need. So approximately 36% of adult Americans only have basic or below basic health literacy skills. Well, I love this because from the health literacy of American adults research, they break that down for you. So that means that they may be able to read or understand a appointment slip or maybe a patient education brochure. They would have trouble with anything beyond that. So information about a drug that they're going to be prescribed, or consent documents, or anything like that would become very difficult and overwhelming for them. And then only 12% of Americans are considered proficient in health literacy skills. So 12%, that is not a lot of people. And then when you look at that number compared to the amount of people in our country, and we are all patients in some form or fashion, that is a really small amount. So these individuals have sufficient levels of health literacy so they can navigate the healthcare system. They know who to talk to. They know where to go. They know how to use the patient portal, the website. They know the questions that they need to ask so they can fully manage their health. But let me just say, I would consider myself in that group. But as healthcare changes, and as my health and my family's health changes, it is an ongoing process. So you never stop learning, because new health issues and situations arise that you've never dealt with before. You may go to a new hospital system, a new physician. So every time that happens, we really are at a disadvantage, and we have to learn new things and go steps further to get back to that proficient level. So low health literacy, and I use this illustration because this is how I have felt many, many times when it comes to figuring out my health care, insurance, appointments, prescriptions, all the things that go into being a patient. It is so overwhelming. And so it's the inability to understand and use health information to make decisions. So patients with low health literacy are at a disadvantage because they are unable to manage their health. And let me just say that as a patient, as a caregiver, being a patient is a lot of work. Being a caregiver is a lot of work. Being able to understand all the things that are thrown at you at once. So let's take a look at some demographic factors. So certain demographic, yes.
Sorry to interrupt.
You're good.
Are you advancing through the slides by any chance?
I am.
Oh,
so they're not showing on your end.
It just advanced to the 5th slide. Huh.
Okay.
Now we see it. Now it's working.
Okay. So now you're seeing what I'm seeing?
Yes.
Okay.
Thanks.
Okay, perfect. Thank you. No. So here's that guy that's frustrated. You guys didn't see him. So here he is. All right. So now you guys are on demographic factors, Allison. Okay, perfect. So this is not just these groups of people, but we do see that these demographic groups do have harder issues, have challenges when it comes to health literacy. So the first are people with lower educational attainment. So this means that maybe they didn't finish high school. Maybe they finished high school, but maybe just had trouble learning altogether. So we see that this is more current with this group of people. Also with the elderly, because let me just speak from a personal place. My parents are both in their late 70s, and so I help them all the time with healthcare and with decisions and with guidance of what to do, what to ask, what to say. I was the first one to tell my parents that they could question what a physician said or their suggestions. They could ask questions. For many of our elderly patients, they feel that that's disrespectful, that is, rude to do that. So we want to make sure that we are helping them to understand. And then also minority groups. So we do see lower health literacy within these groups, and especially within groups that have come to the U.S., that English is not their native language, that this is a new country and experience for them. And also, as I just said, that's into that same group of immigrants. So we see that not only socioeconomically low areas or neighborhoods or regions will have lower health literacy, but also regions that have a higher percentage of immigrants. And I always say, especially here in Florida, I know all of our participants aren't from the state of Florida, but here in Orlando, I really feel that this is a melting pot, that, this is a place where all languages, all cultures come together. And so that's so important. And so then our next, we're going to go forward, is educationally sensitive patient outcome perspective. So we want to look at, what is happening with our educationally sensitive patient. So this really is linked to greater mortality, poor global health status, increased hospitalizations, and even increased emergency care use. So with low health literacy, we see worse asthma severity. We see poor diabetic control. We see obesity. So what this tells us is that patients are not understanding. They don't know the seriousness of their condition possibly, or they maybe don't understand how to complete the treatment that is necessary for their illness. And so then we also see a strong predictor of outcomes can also be race and ethnicity, income, and education. And we touched on most of those in the earlier slide, but all of these have effects not only on low health literacy, but on patient outcomes. The health outcomes or the goals that we have for patients are not achieved because of these 3 areas. So the next part of this slide I have in red. because I want you to understand that only over the past decade have we really seen health literacy become something of importance. Have we seen it talked about by the Institute of Medicine, the Joint Commission, the World Health Organization? Because remember, before these things are required, they're not going to happen within our healthcare systems. Because it has to be a requirement. And I've learned that long ago. So we are seeing that more and more become something that is important because it is required by these health groups or health organizations. So in 2010, which wasn't long ago, we have the National Action Plan, and it really, started looking at health literacy across sectors, how that affected education, research, and those kind of things. So we're going to talk about Healthy People 2030. And first, I want to talk about what Healthy People is. So every 10 years, the U.S. Department of Health and Human Services comes out with a set of objectives for the year. This or for the 10-year period. I'll get that out in a second. So the very first one came out in 1980, and now we're at 2024. So we are now in the Healthy People 2030. That is our decade that we're working within now. And so this is the 5th iteration of this initiative. And so what it does is it helps individuals, organizations, and then communities just become more committed to improving health and wellness. So it makes it a priority. So they tell us, okay, these are the things that we're going to focus on within this next 10-year period. So what's really awesome is that health literacy is now part of that. And so that is something that is new, but it's very exciting, especially for someone like myself that's a health literacy advocate. So let's look at the 6 that are a part of this initiative. So right now, before 2030, these are the goals that have to do with health literacy. So number 1, we want to increase the proportion of adults whose healthcare providers check their understanding. So this falls on both groups. This is not just the patient. This is what's being required by the medical professionals. So we've got to make sure that as healthcare professionals, we're checking what the patient understands. Then also a decrease in the proportion of adults who report poor communication with their healthcare provider. So for a lot of healthcare facilities, they do surveys each year about what their patients feel about their care, about their interactions, that kind of thing. And so we want to see less and less of patients feeling that there was poor communication. And here's what the hard part is. A lot of healthcare professionals don't even know that they're giving poor communication because patients don't tell them. So if a patient doesn't stop their nurse and say, I don't really understand what you just said, or can you tell me that again? Can you write that down? Can you help me understand? Our healthcare professionals aren't going to know. So, I want to take up for them in that they are doing the best they know unless patients speak up and share that they don't understand. Then we want to see an increase the proportion of adults whose healthcare providers involve them in decisions. So again, we want patients to be a very active part of their healthcare team. We also want to make sure that people who say their online medical record is easy to understand increases. We want people to be able to use the portals, use the websites, know who to call to get their information. And then also we want to increase the amount of adults with limited English proficiency that say their understanding. We want that to increase. And then also, this is kind of general, but increase the health literacy of the population. So I'm just excited that these things are here. And so we're going to talk a little bit about what that means. So health literacy people have come out with definitions. So there's 2. There's one for the personal health literacy and also one for organizational. So with the personal one, it really is just the degree that people understand their health. Where are they finding things? Do they understand what they get? Is it written or given to them in a way they can understand? Is it in their native language? Then can they use that to make really thoughtful healthcare decisions? But then we look at the organizational health literacy. What are they held responsible for? Well, do they enable individuals? Do they help people do that first definition? Do they help them find, understand, and use information? Do they involve them in the healthcare decision-making process? So that, they're very similar, but it really is organizations enabling patients to have better health literacy. Okay, so improving health literacy helps in a lot of ways, but when I found this illustration, I really loved it. I'm a very visual learner, so the pictures and breaking this down helps a lot. And then that goes back to how we can gain better health outcomes. When patients have something they're comfortable with, when they have something they can understand, it makes all the difference, especially when they leave the doctor's office or leave the hospital to practice self-care. So first of all, people with improving health literacy can find the doctors and the services they need. And let me just say, that is difficult. That is even difficult for me. Right now, I'm working, trying to find a mental health counselor for a patient. And so I've involved some people in that area that I know to help me with that, but it's not been an easy process. So that can become very discouraging. And what happens is then patients just give up. And they say, okay, I can't find a physician. I'm just not going to one. It's just too hard. We also see that people with improving health literacy know how to manage their health, their chronic pain health conditions much better. We also see that they can get to places and the appointments that they need. They can take their medicine the right way. Also, they can fill out health forms and access their online health record, which let me just stop here also, because anyone who knows me knows I'm very transparent. And I just want to say, about 2 years ago, I changed healthcare companies. And so when I did that, all of my healthcare changed, all of my physicians changed, my insurance changed, and I had to learn a new patient portal. And let me just say, I'm not always technically the best. Allison can tell you about that. So, but I had to go to my husband, who's very techie. He catches things so quickly. And I was like, okay, walk me through how to use this new portal. So a lot of patients become discouraged and they just don't even use it. So they have all these tools and all this information, but because of not understanding or not having the experience with it, they don't use it. We also see patients with improving health literacy. They take their medications, they take them the right way. They understand what they're for. I can't tell you how many patients I would say, now, why do you take XYZ medications? And they would say, because my doctor tells me to. And they didn't know what they were for, why, any of these things. And that's really frightening for me. I want them to understand that. Health literacy, health literate patients can fill out forms. They're very difficult. I don't know about you, but the last time 2 years ago, when we had to change all of our physicians, one of my husband's specialists, the new patient forms, there were 10 pages. And it took he and I sitting down. We actually printed them out at home and did them at home. I encourage that. I encourage you to tell your patients to do that. Takes a lot of anxiety off of them. But it took us about 45 minutes. This is 2 college graduates and a research librarian. It took us that long to fill out all his information. And then also people with improving health literacy or high health literacy share their medical history or anything happening. They have a more healthy lifestyle, and we know that that's because they've learned about it, they know about it, and they also follow advice from their healthcare team. Okay, so what are patient outcomes? Okay, so a couple different ways of looking at this. Number one, it's the patient health status or quality of life. So are you improving? Has your condition improved? This is what we want. This is the outcome that we're looking for. But patient, provider, and also population attitudes and behaviors have a lot to do with patient outcomes. And then we're always looking at new evidence, new research, preventative strategies, treatments, and care models that can help patient outcomes improve. Okay, so we're going to take a closer look at patients with low health literacy. So we're going to look at their safety, their health behaviors, their status, and also healthcare utilization and cost. So we're breaking these down a little bit. So first, let's talk about patient safety, because if you've ever worked in a healthcare facility, and I know a lot of you do or have, you know that patient safety is top. That is number one across the board, or it needs to be. But what we see with patients with low health literacy is a lot of misunderstanding. So again, we go back to medical terminology. So let me just say, healthcare providers don't speak in medical terminology to confuse you. That's their world. That's what they are used to talking to each other with. So I give the example of, for years, I was on different committees at the hospital, and it was usually made up of all healthcare professionals and then a few of us that were not clinicians. And we were in a meeting once with a lot of nursing leadership, and they were talking about different things that we were going to do, some new patient initiatives. And I was thrilled that I was brought into this group and allowed to be kind of the voice of the patient. But along the way, in one of the first meetings, they were throwing all this terminology out that I had no idea what it was. So I raised my hand, because you've got to be confident. You're not going to look dumb to ask questions. And I tell patients that all the time. And I said, I have no idea what that is that you're talking about. And the nurse leader looked at me and she said, Jessica, I am so sorry. I forget that you're not a nurse. Well, that was a huge compliment, because I was seen as a peer, but it was a great way for me to use that analogy with healthcare professionals. That's how our patients feel. Physicians, nurses, all the people that touch patients, they often forget that patients don't know the things that they're saying. So we also have to be really careful with instructions. So I am a huge bullet proponent. So if you can bullet things and no more than 5 bullets together, that's going to really help. If you give instructions in paragraph form, often patients become overwhelmed and never even look at it. And then medication use, being so specific of when to take it, how to take it. Don't just give a prescription. Don't just say, take this. Or don't even just say, do you have any questions? Because most patients are going to say no, no matter if they have questions or not. So you want to say, okay, maybe even write it down. You're going to take this medication when you wake up in the morning. You're going to take it before bed. These are how many pills you're taking, all of these type things. And then follow-up appointments. And let me just say, I'm not going to get on my soapbox here, but this is really a frustrating area for patients. And even my personal experience, this has been a really frustrating area, because my husband's left the hospital before and our orders say, see your primary or see your cardiologist within 2 weeks. So we get home, I call, and they say, well, we can't see you for 2 months. We're booked out for 2 months. Okay. What are patients supposed to do? So there's that miscommunication between discharging patients and making those appointments. And so some hospitals and facilities actually make those for you, which is outstanding if they do that for you. But often that isn't the case. So guess what patients do? They don't go to follow-ups. They're too difficult. And so what happens again is those patients in about a month or two are back in the ER. They're back in the hospital because they didn't have that follow-up and that plan created for them. So also the last thing I want to mention is think about your signage and directions that you give patients. So several years ago at another system I worked for, I was on a committee to talk about our signage across our campuses and how important it was, because here's what was happening. When we talk about different groups, I'll talk about at that time the oncology center, our cancer center, they were having a lot of patients not show up for appointments, and they couldn't figure out what was going on. And a lot of these were new patients. So these were their initial visits or their initial treatments. And so when they talked to them later, they said, oh, we came all the way to the hospital. We parked in the parking deck, we got on campus, and then we got lost and we got really upset and we went home. So that is really important. So make sure your patients know how to get from one place to another. Make sure you have really clear maps and signage. That is very key. Okay, so next is health behavior. So we see that people with low health literacy are less likely to engage in these things. So preventative services, why am I going for a checkup when I'm not sick? Why am I going to the dentist when I don't have a toothache? Why am I going to go to the dermatologist unless I have a rash? So people really don't understand, and they need to know how important preventative care is. But if we don't explain it to them, then they're not going to know. And then also cancer screenings. And so I saw this for 5 years working closely with a cancer center. that people were very unaware of cancer screenings. They were unaware of why to do it, but they also were afraid to do that, to do it. You know, I had so many women tell me over the years, Jessica, I'm terrified to have a mammogram. What if they find breast cancer? And so my comeback to that always was, okay, here's the deal. If you have breast cancer, do you want to discover it at stage 1 or stage 4? And that's what I used to use that analogy. You know, think about like, no one wants to discover that they have cancer, but I want to discover it if I do very early on. So yes, do I get nervous every year at having a mammogram? I do. Do I kind of hold my breath until those results come? I do. And even more for me because my mom is a breast cancer survivor. So I get that, but I still want to know because she found hers early on and about 10 years out, she's doing excellent. So that's the outcomes that we want when we talk about patient outcomes. And then next, we see that people with low health literacy don't really adopt healthy lifestyles. And, you know, sometimes when you have a healthy lifestyle, you know, we can be very judgmental of others. And we got to be really careful of that. You know, about, I'd say 3 or 4 years ago, my husband and I really changed our lifestyle when it comes to eating, to our diet. And so we can't impose that on others. Now, when people say, you guys act like you feel great or you guys look great, what's your secret? Well, then we'll share, hey, we don't do gluten and we don't do processed sugar. And about the time we say processed sugar, people are like, oh my God, no, I can't do that. But, you know, if you ask, we're going to tell you how great we feel since we're not on that. But it really does come down to them not really knowing the benefits of a healthy lifestyle. Also, people all automatically think healthy lifestyle equates losing weight. Well, you may need to lose weight. It may help you to lose weight, but it's to help you feel good. That's the outcomes we want. So that deals with diet, exercise, and sleep. So then we go into health status. So where are people when they have low health literacy? Well, they normally have poor physical health and also poor mental health because they don't understand that our mental health is just as important as our physical. And so we see a lot of people with low health literacy skills suffering from depression and anxiety, but going untreated, going unhelped. And so we want to really stop that as well. So then we come into healthcare utilization and costs. So for many people, healthcare is beyond what they can afford. And because of low health literacy, they have poor outcomes, and then they're back in the hospital and the doctor's office more often. And so it's just this vicious cycle. So we see with patients with lower health literacy, higher hospitalizations, they're readmitted within 30 days. And I know any of you in the healthcare system know that is what you're trying to keep from happening. You don't want them readmitted ever, but you don't want them readmitted within 30 days. And then they frequently use the emergency room. They're in the ER very often with all types of things because some they may need to be there for, some maybe not because they don't understand what an emergency is. What should I go to an immediate care for? What should I go to my doctor for? That kind of understanding causes people to be in the ER much more frequently. And then there is, of course, because of that vicious cycle, higher healthcare costs. So who is responsible? And that's what we want to talk about a little more in depth. And I'm going to let you know that it's the entire healthcare team, but we're going to look at who's responsible for what. So we first see that the decision makers within a hospital or a medical practice are responsible for patient outcomes. So this is your administration, this is your leadership. We also see that physicians, as well as all support medical staff or medical professionals, are responsible. And so that means everyone that touches the patient, everyone that has a hand in their journey is responsible. And then team leaders of all kinds. And we talked about, administrative leadership, but team leaders are responsible. So this might be a nurse leader on a floor. This may be an office manager within the actual administrative office of a practice or a hospital. So let me just say, all of these people that are leading other people are responsible for these outcomes. And then patients and their caregivers also hold responsibility, making sure that the patient outcomes that are desired are actually achieved. So let's break this down a little bit. So quality of care. So that's going to be your healthcare administration, that's going to be your healthcare professionals, and any support staff. So we want to make sure that our patients are safe. We want to make sure that we don't have readmissions. We want to make sure that all of our processes are very effective and that there's equity, that everyone is treated as they should be treated. So quality of care is so important, but this really is on the side of administrative and our healthcare professionals and teams. So then we look at operational efficiency. So healthcare administration and our healthcare professionals are responsible for this piece of the puzzle. So we're wanting shorter wait times for patients. We want to be more effective with patient time. Now, of course, emergencies happen all the time. You know, we've been at the cardiologist before where it was just a regular checkup, and after about an hour of sitting there waiting, we would go up and ask, or someone would come out and say, hey, we're so sorry, but the patient before you had an emergency. Well, guess what? We've been that patient before, so we understand, but it's so important to communicate that to people that are waiting. Just that whole process. Like, what do we do if we have to make a patient wait? Do we offer them some water, a snack? Do we, tell them that they could go walk around outside and we'll text them when we're ready? So thinking of making that better. Cheaper costs for patients. So a lot of physicians will help with medication costs. They will say you don't really have to come back for a visit unless you have an issue. Maybe they're giving you coupons and different codes that you can try medication at a much cheaper rate. And then we want to reduce unneeded tests. And I know our keynote talked about that, and I thought that was awesome, that sometimes as medical professionals to be really careful. You may order tests just to make certain, just to make sure. And while that's great, we need to make sure that we're not causing them to have to take tests that are unneeded. And then also being very efficient with admittance and discharge in the hospital. Sometimes that can be a very difficult process. And so just making sure that those practices are updated and just really well defined so that it's easier for the patient. And so now we get to patient satisfaction. And this is when hospital systems and physicians' offices, they look at these and they go, okay, these aren't the outcomes we want. These are not the things we want to see. Or maybe they are, but you just want to continue to get even better. But this is up to our administration, our healthcare professionals, the medical support staff, and patients. So this has to do with everybody. Everybody's responsible of this. So the level of satisfaction with care. So here's what I want to say with this. Number one, if you're unhappy with your care, but you don't speak up, then that's on you. Like, I don't mean to be really blunt about that, but as patients and as our own healthcare advocate, we've got to speak up. So we have to say when we're not comfortable with something, when we're not pleased with something, when it's not the result that we wanted. And then we also have to make sure that if we're not satisfied with a physician and it's just not a good fit, that we're proactive to find one that is. But also feelings about the online platform. Okay, so here's the whole thing with that. You could have an excellent online platform that just is beautiful and just so helpful to patients. But again, think about if I signed on to a patient satisfaction survey when I first changed healthcare providers and I didn't understand the portal. I would have probably said low satisfaction. I'm confused. I don't know how to use it. But then once my husband walked me through the process and explained it to me, oh, I think it's great. I love it. I understand it. I would give much higher satisfaction. So it really is important that we make sure that we're equipping patients so that they know how to use these platforms. And then also, if a patient refuses to use that platform, how can we communicate with them in alternative ways and still inform them? We can't just say it's on the patient portal. If you can't understand it, oh, well, you don't get the info. We can't do that. And then also clinical treatment. Did patients receive the care and the outcomes that they desired? And so then also that goes to clear communication. And we've talked about that a lot today. I know I have. But just really having that open and honest conversations with your healthcare providers. And then also appointment scheduling. So again, we talked about that with the whole discharge process. If that is difficult, then that's going to lower your patient satisfaction. So, and also don't promise anything you can't do. So I will tell you that a healthcare provider that I worked for years, their cancer center promised that if you were diagnosed with cancer, that within 72 hours, you would have an appointment with an oncologist. So, or you would be seen by an oncologist. Let me say that. So that was a huge promise. And so they had to make sure they were equipped with staff, with their medical professionals before they could make that promise. And I will say they did it. But that is a big challenge. So making sure that you can schedule things when you promise is very important. So one thing I want to talk about is a new term that, well, it's new to me in the last year or so, and that's patient activation. And really it coincides with being health literate. So Dr. Judith Hibbard and her colleagues at the University of Oregon, they kind of really claimed this definition, came up with this. And so they see it as an individual's willingness and ability to take independent actions to manage their health care. So this doesn't mean you just understand. This means that you are an active participant, that you are independently taking action with your health. Nobody has to tell you, you're just doing it. So in other words, it means that these patients have skills, knowledge, and confidence. And so I think that's so important because you can understand the system, you can have the knowledge, but if you are very self-conscious, very uncomfortable speaking to your healthcare professionals, that's going to inhibit you. So that confidence is so important. All right. So I loved this definition and I loved it enough. I wanted to share it, but it says patient activation. So patients who are activated or more involved in their health tend to have better health outcomes. So let's think about that for a minute. If you are very involved in your health, you understand it, you're doing all the things you can, you're going to have better outcomes than a patient that's not. And also, here's what we love to hear on the professional side and also the patient side, there's lower costs associated with that patient. So I want to show you how that works. So findings from over 180 peer-reviewed studies. Okay, so that's a lot of studies. So this is the results that we've gotten from those studies. Number one, higher activated individuals engage in positive health behaviors. So they're going to do that preventative care. They're going to lead a more healthy lifestyle. And guess what? Doesn't take a rocket scientist to understand this. They have better health outcomes. They have better patient outcomes in the end. Also, we see that these patients have better care experiences. So let's talk about that for a second. So let's say that you go into your physician's office and they are rushing because a lot of times they are timed. Let me make sure you know that too. They're rushing. They are not really asking you many questions. And at the end of the visit, you feel very unheard. You don't feel like your questions were answered, that kind of thing, because you didn't speak up. You just let that appointment unfold. But on the flip, for an activated patient, as soon as the nurse begins to rush, you say something to, wow, I can see that you're in a big hurry. I hope you have time to answer all my questions. Well, what that's going to do is that's going to automatically slow that person down, make them aware that you're aware that they're rushing, and they're going to be more open to what you're talking about. Also beginning an appointment by saying, I've written down my concerns and here they are, so that you know that all of those concerns are covered before you leave that appointment. So of course, these patients are going to have better care experiences. Also, these patients have lower costs. So look at this difference. An activated patient versus a lower activated patient, they say about $2,000 annually they will spend less than the patient that's not activated and involved in their health. That's a lot of money. Like that's a real, that's enough to, let's talk vacation money with that. So I would much rather be using that money to go to the beach than to go to additional physician appointments or have hospitalizations. So here's how we measure patient activation. And Dr. Hibbard and her colleagues came up with this chart. I won't go into it deep, but my presentation will be available for you. And this is a reference there, of course. But level 1 is where we find a lot of our patients, and this is disengaged and overwhelmed. And so I love the little quote here: my doctor's in charge of my health. No, they are in partnership with you for your health. But then we got a level 2, becoming aware but still struggling. Then a level 3, you're taking some action and you're gaining control, where most of us lie in level 3 most of the time, especially when something new arises. But then level 4 is where we want to be, and we maintain behaviors and we're pushing forward. I love the quote here: I'm my own health advocate. So I am responsible for my health. So this is just a couple other things about activated patients that I loved. They believe they have an important role. They don't just say it, they believe it. They develop a confidence, and that's what I was talking about, that they can speak up, they can ask questions. They understand how to gain information, where it is, how to get it, who to call when they need things. They can also translate what they learn, their knowledge, into actually action. So not only knowing it, but knowing how to make that happen in a physical way. And then they also just maintain an active role even when faced with challenges. So maybe a new diagnosis, maybe there's a setback in your health, but you're okay because you know what to do. So that alleviates so much fear in those situations. So I just have to tell you, success is going to come from everyone being in charge. So that goes from our caregivers to our support staff, to our nurses, our physicians. The whole team really does play a huge role in this whole process. But I'm going to end by talking to you a little bit about communication, because if this is an area that you struggle, this is where I want you to really focus. And this comes from medical professionals as well as patients. Communication is key, and we're not all just naturally good at it. And we also may communicate better in different ways. So let me give you just a few ideas with that. So there's different types of communication. Number 1, there's medical provider to patient. So these are our medical professionals. This is how you communicate information to the patient. That is so critical. It's so important that you use plain language. I loved, our opening session about numeracy and making sure that you share numbers that matter and that you explain those numbers. But then we also have patient to medical provider. So this is where, I've really been a huge educator and push is that patients learn how to speak with their providers, that they are prepared before a visit. They've written down their concerns. They've written down their questions. They're ready for the appointment. And then also medical provider to patient caregiver. So let me just say on this one, I have been the caregiver for my husband and my daughter for many years, and I loved medical professionals, physicians, nurses, no matter the specialty, that would engage with me as well. And, look at me, engage me in the conversation, because if I didn't understand, then the right care was not going to happen at home. So valuing that medical provider to patient caregiver, and then patient caregiver to provider. So for the caregiver to ask questions, to be involved, never really take over because it's the patient's role to be in charge, but to also have conversations with the patient before the appointment. Maybe say, what do you want to talk about? What do you want me to talk about? Would you rather me ask the questions? Do you want me to write things down? To make sure all of that is clear before you get started. Okay, so here are all of my resources I use today. What I do on most all of these, they are, free to the public, free access that you can look at online, that I would share with patients. I do encourage healthcare providers too to look at patient materials. We talked about that some today too, just making sure that they are clear, they are concise, they have exactly what they need and not more. And even earlier today, one of my colleagues even said, never give more than 2 pages. Really, even if you can, do a front and back, and just a lot of different tips in those areas too that you can learn more about as well. So Allison, I'm gonna stop now and see if there's any questions or comments or anything about anything we've talked about.
Yeah, thanks, Jessica. So we do
Sure.
have a question from Meredith on that slide about the difference in healthcare costs between an activated patient and a non-activated patient. That
Okay.
31% difference, do we know what it's associated with?
Well, the studies that they used and they kind of consolidated it for that information, what they said there was that they actually worked with two different groups, patients, of course, that were very inactive in their health versus patients that were active. And they actually looked at their healthcare costs throughout a year span. And so what they were able to see is many of them had very similar situations. So maybe you had two patients with diabetes, or maybe you had two patients that were going through similar cancer treatments or diagnosis. And then they saw, additional visits, additional situations that maybe could have been avoided had they understood or been, an active participant. So that's where and how they got those numbers is just comparing groups of patients that were very similar, but patients that they would evaluate and consider very active in their healthcare versus patients that were very, withdrawn, didn't really ask questions, weren't involved in what was going on, that kind of thing. So I don't know if that answered, but that's how they came up with those numbers. So that was kind of an average of it being about 2,000 more for patients that were disengaged.
Right, so a number of things. It depends on the
Yes.
health condition, of course.
Yes.
And we've got a question from Debbie.
Not really so much a question as a comment that we need to remember as providers that the family is a great resource to be utilized. And even in your practice, if you don't have what some people call patient navigators or
Yeah.
assistants or whatever, you can, as a provider, look at your clients, pick out one or two people that you feel understand where you're going with treatments and things, and let them even look at forms and resources that you're giving out to patients. Let them see if it makes sense to them. Let them see, is it something someone could easily understand? Because I have the um, unique sometimes feeling of being on both sides of the fence because I have twins with special needs and I'm a nurse. So I can kind of see both things. It's important to utilize families as resources, not just assume anything about a family, because you don't oftentimes know the background of that family and exactly what they can do to help you. But be open to that. Be open to let them look at your forms. Be open to let them help you as much as they can communicate with others in the position that they are in as well.
No, Debbie, I 100% agree. And then that's also important, I think, for on the healthcare professional side, the clinician side, for us to always make sure that patients understand
Hmm.
putting people's names down that can access their
Right.
information, that can ask questions. Because just recently it was so funny, and this is me. My daughter is now 20, and so she had to have some tests done, and I
Uh-huh.
called trying to be a helpful mom,
Uh-uh.
and she's a college
She's an adult.
and she's an adult now, and she had not put me down. She had
Hmm.
asked me, Mom, will you call and see if they can change this appointment? And when I called, they're like, Miss Daly, we're so sorry, but you're not down on Taylor's information. So I think that's really important to
Right.
make sure patients know who they trust and who they can put down for that information. But yeah, caregivers, I don't say it just because I am one, but
Yeah.
they do so much and they guide the patient when the patient can't. And so it is so important to use them as a resource.
Right. And it's important for providers to realize, like I said, there are all manner of people being caregivers and
Yes,
parents and whatever. Do not put us all in one box. The only box we're in is the fact that we're trying to help someone. That's the only
absolutely.
box.
Oh, I
So
love that, Debbie.
yeah, so be open to us, be communicative with us. And I also think on the other side of that coin, it's very important for providers to make families, patients slash caregivers understand that they hold a responsibility as well. It's not a us and them thing, it's a partnership, and it only works if we're working together.
Absolutely. Well, thank you so much, Debbie.
Meredith, do you have a comment as well or another question?
I actually have a question. Thanks, Allison. It's regarding your good point about checking the significance of organizational health literacy and making sure that patients can access being able to schedule an appointment, taking their medicines correctly. Are there resources available for organizations to get tools for how to improve their own organization's health literacy? And are there funding sources for those who don't offer language assistance at their practice?
There are some different things. If Allison will put my email in the chat, feel free to email me and just let me know in the email that's what you're wanting, and I will be happy to send you some info. But there are, online free training modules, different things, different resources. And really the other piece of that is the Healthy People 2030. That's a great resource to use because that breaks down everything really detailed and ways of achieving those goals. And then that also may be something to share within your hospital, within your practice, even within like your area where you are, that, hey, are we following these guidelines? Did you know about these? So yeah, most definitely. And then even see, like what is required by Joint Commission or whoever is accrediting your facility or your hospital, what pieces in there are about health literacy, because sometimes those are overlooked and not even addressed. So, they might be there and that be more backing to say, hey, we need to do more in this area and we're actually required to do more in this area. We've got to prove that. So that's kind of how I did it for 5 years within the system I was in. Is I discovered what they were required to do by the Joint Commission, and that got attention. And they said, yeah, we want to make them happy. We want to continue to be open and functioning. So that's what I would encourage. Just email me and I can send you some of those resources. Be happy to do that.